Okay, now we're going to be looking at some neuromuscular disorders. One of the things I do want to point out before talking about some of the specific ones is if you look on table 1313 in your textbook, they go through the neuromuscular disorders and what structures they affect. So again, that's kind of one of those things again where you could kind of remember like what the actual structure is and what the potential pathology is. So the first one we're going to look at is a motor neuron disease, amyotrophic lateral sclerosis, or ALS, or what people also know as Lou Gehrig's disease. It's the etiology is unknown. They do believe that it can potentially be linked to an autoimmune response with the nervous system. Typically it occurs in adulthood and middle age. The prognosis for this is not good. Most people die within 3 years of onset. They could live up to 10 years. But what happens is with this disease is it degenerates the nerve fibers and neurons in the neuromuscular system, progressing from distal to proximal. So what typically happens is you get gradual weakness in the hands and arms, and then eventually the disease progresses, and it progresses to the point where your breathing gets affected, your swallowing gets affected. Cognition does not. So it does not affect cognition. It does not affect those areas of the brain. It's strictly a motor neuron disease. So the idea is treatment-wise to maintain speech, maintain mobility, and maintain feeding and breathing as best you can. Death usually occurs with this due to a respiratory failure because of the fact the muscles that control breathing end up getting affected. Another motor neuron disease, poliomyelitis or polio. It's a disease caused by the polio virus. It pretty much for the most part, because of immunizations, has been eliminated. It was a very common disease many years ago, but because of the vaccine, it's for the most part gotten rid of it. You may occasionally encounter somebody who has had polio when they were a child. But not too likely. So just, again, be aware of as far as what it affects. So again, it does affect motor neurons. Sometimes people do develop post-polio syndrome, which is very common among polio survivors, and it will usually occur about 2 to 3 decades after the initial infection, and it'll involve muscular fatigue, atrophy, things of that nature. You can look up the signs and symptoms of it, but it is something that can be treated symptomatically. Peripheral neuropathy is kind of just a generic term, so it's something that describes many different disorders of nerve fibers. Particularly, this affects axons of nerves, and it can affect both motor and sensory issues. It's something that is associated with another condition. So, for instance, one of the conditions that peripheral neuropathy is very much associated is in individuals with diabetes. They develop some, particularly some sensory loss issues could happen with that. It could also happen due to trauma. We see a lot of peripheral neuropathies with orthopedic injuries due to trauma. So anything that would traumatize that at the axon of a nerve. So, for instance, if someone were to get a stinger in their neck and shoulder area, that would be described as a peripheral neuropathy. So just depending upon what is causing it, could cause anything from motor loss, sensory loss, even possibly vasomotor control. We have some of the conditions on here. Again, the treatment, for the most part, it's just going to depend upon what causes the peripheral neuropathy. Guillain-Barre Syndrome, that's another neuromuscular disorder that will affect the axon of the nerves, and it's another autoimmune disease. It's an autoimmune response to a viral infection. So many times people who get Guillain-Barre Syndrome, it could stem from just a simple viral infection, like a respiratory infection that was a viral infection that for some reason their body takes to this disorder. It's a demyelinating polyneuropathy. So you can see here in the picture, it's kind of showing you, so it shows you the normal nerve with the myelin sheath around it, and then it shows you the exposed nerve fiber because the myelin gets damaged. So polyneuropathy just means it affects many nerves. And the biggest issue associated with Guillain-Barré is the potential loss of respiratory control, and at that point it does become a medical emergency. What you typically get with this is it usually starts as symmetric weakness in both legs. It progresses to the arms, and eventually, if it continues to go, it could turn into something where somebody gets respiratory failure. People can recover from this. It takes many months to recover from it, but the problem that many people often have is that the residual weakness associated with it can take years and persist for many years. So it can take a while to not only recover from, but it could also take a while for people to get their full strength back. Myasthenia gravis is an autoimmune disorder at the neuromuscular junction. So here now we're looking at the neuromuscular junction, so the junction between the nerve and the actual muscle cell. So again, you can look at the illustration on the slide, kind of showing you the neuromuscular junction and what exactly happens with this. And what happens is it's an autoimmune response, and it destroys the postsynaptic acetylcholine receptors. So acetylcholine is what gets released in the junction between the nerve and the muscle cell. So you can see the close-up of that. It shows you the normal nerve transmission, where you can see acetylcholine getting released from the nerve ending and attaching to the acetylcholine receptor, whereas in the individual with myasthenia gravis, you can see the antibody that forms that prevents the acetylcholine from meeting up with the receptor. So this then turns into some neuromuscular issues that can occur because of this. This takes place again at the neuromuscular junction. So again, function can be restored from this. No particular cure exists. Again, you can look and see what some of the medical treatment consists of when you're putting together your signs and symptoms chart. Okay, now looking at muscular dystrophy, so now we're looking at a disorder that specifically just affects the muscle. Okay, so again, I'm going off of that chart, that table that's in your text. So muscular dystrophy is a class of genetic disorders that affects the actual structure of the muscle fiber. Duchenne's muscular dystrophy is an example of a very common form of muscular dystrophy. So what basically happens here is that muscle fibers will actually degenerate, and they get replaced with non-contractile tissue. So it's basically like if you could picture your muscle tissue basically just wasting away and getting replaced with like non-functional scar tissue. That's basically what ends up happening. And in most instances it happens for people in the proximal limb girdle muscles first. It's a very disabling condition. It usually requires the use of a wheelchair by 10 years of age. It typically does involve a shortened lifespan just due to the inactivity that most people end up having to deal with. There are other less disabling forms of it. So again, some of the prognosis just depends upon what type of muscular dystrophy an individual have. There's no cure. I did list some potential treatments. Again, just make sure to look for specifics as well in your text. So you can utilize corticosteroids to limit inflammation, and you can use safe exercise for the individuals to prevent obesity. Okay, and just sort of a wrap up, or again, of just looking at neuromotor diseases. So again, look at various things. What do they affect? So what structures do they affect? And then what happens secondary to that? So some of this comes back to the anatomy and physiology discussion that we talked about in class. Again, this is some ways that you could distinguish some of the differences between all of these disorders, so it can help you remember them better. How can the issues be addressed? So what's viable to treat these conditions? Okay, are some of them that you basically just limiting the progression of the disorder? Are there things that can be done to help maintain function? And then ask, can these individuals participate in sports? So some neuromotor diseases, an individual will be able to participate in sports, but if they can, it could possibly put them at risk for certain injuries, more so than a healthy person would. So, when you go through and look at these conditions again, ask yourself these questions, and it could kind of help, hopefully allow you to remember things about these conditions. So if you're asked questions about them, you could then recall some of that information. And these are some of the learning outcomes, again, as an outline to look at the rest of the chapter.